So if, for example, uh, if we do a very good job, as you're saying, based on this timeline, hopefully getting to the lower end of this curve in the fall, September, October, um, could you foresee still these international travel restrictions in place? Because there are, each country is handling their situation differently, and maybe we become very good at it, but then if we have neighbors to the south and we open that border up, could that then now make an influx of cases back in Canada? So how do you foresee us dealing with international borders, people outside of our country, if, for example, Canadians do a very good job within their own country managing this?
Yeah, so first let me answer your question on international travel restrictions. We can't tell what's going to happen 1 week from now, so it's very, very difficult to even speculate what's going to happen a couple months from now. I don't have an answer for what's going to happen with international travel and whether there are going to be travel restrictions. I imagine things as they morph out over the summertime and we see, or hopefully, inshallah, see these cases decline, some of those travel restrictions will be eased, and the people that are traveling are following the best healthcare guidance and self-isolating for 14 days after they land. But I can't give you a definitive answer on that. In terms of our neighbors to the south, that issue is a little bit more complicated. So as you said, the US is now highest for cases in the world, and the biggest concern we have in public health right now is if they become an epicenter. So the first epicenter was, of course, in China, where this virus originated from, and then it shifted to Italy and Spain not far behind, where also had a large number of cases and subsequently a large number of deaths. But because the US was not very aggressive and didn't have a coordinated plan, they were not able to put in place their social distancing restrictions and limitations and gatherings. So they've had a lot of potentially infected people out there in the community. And of course, because they didn't have enough testing to do, and they still don't, their numbers that they're reporting are always going to be an underestimate of what the actual infection rate in the population is in the United States. So our concern is that because it's being underreported, they have more cases than what they're saying. They could potentially, if they continue to cross the border, or if the borders open back up and these people start to cross back into Canada, they could potentially start to infect Canadians.